Okay, hi, my name is Nurse David. I'm here to do a head-to-toe assessment on you. Do you have any questions?
No.
I'm going to ask you what your birthday and name is.
Matthew Gutierrez, February 21st, 2002.
Okay. I'm going to ask you a couple questions. What color is the sky?
Blue.
Who's the current president of the United States?
Donald Trump.
Where are you right now?
My brother's room.
Okay. Can you please step on the scale so I can get your weight? Uh, 190. Okay. In order for me to test your visuals, I would use a Snellen chart. You would have to cover one eye, stand 10 feet away, and then cover the other eye, and you would have to read a bunch of letters on a line. Next, I'm going to test your radial pulse. Okay, next I'm going to check your temperature. Please open your mouth and lift your tongue. Close. Next. Temp is 97.6. Respirations is 20. Next, I'm going to check your pulse ox. Please stick your finger out. Okay. 98. Good. Okay. Next, I'm going to check your blood pressure. Over 80. So 120 over 80. Okay. Next, I'm gonna ask you your pain level. 0 to 10. 0 being nothing. 10 being a trip to the hospital. Would you rate your pain?
0.
Okay. Next, I'm gonna start your skin assessment. So, check your hands for any lesions. Skin feels warm. No moisture. Nails feel smooth. Next, I'm gonna check your turgor. Good turgor. Okay. Next, I'm gonna check your head and face. Before doing this, I would have hand hygiene and then don gloves. Okay, so check your scalp for any lesions. No lesions. Okay, I'm gonna test your cranial nerve 7. Smile for me. Frown. Angry face. Pouting. Okay. Next, I'm gonna check your temporal and your +2. Okay. Open and close your mouth for your temporal mandibular joint. Okay. Next, I'm gonna check your maxillary and your frontal sinuses. Is there any pressure? Any pressure? Okay. I would remove gloves and then hand hygiene. Next, I'm gonna check your eyes. So, okay, cover your left eye while I cover my right. Okay, let me know when you can see it.
I can see it.
Okay. Other eye, let me know when you can see it.
I can see it.
Okay. Next, I'm gonna check your eye muscles. Follow my pen without moving your head. Okay. Now fixate on the pen as I move it closer to your face. Nice. Okay, so now I'm gonna check your pupil reflexes. I'm gonna dim the lights. Look at the line in the behind me. Nice. Okay. Pupils constricted equally. Take a look at your pupils. Pupils are equal. Sclera is white and clear. No pus. Conjunctiva is clear. I would use an ophthalmoscope in order to check the retina of your eye along with the disc and vessels. So next I'm going to check your ear. Ear seems to not have any lesions. Patient has his ears pierced. Do you have any complications with your ear piercings at all?
No.
Upon me touching your ear, is there any tenderness?
No.
Okay. So I would have an otoscope. I would pull the pinna back, up and back, and then look into his ear. Minimal wax. From what I can see now, his tympanic membrane should be a silverish pearly color. Next, I'm going to test your hearing. So can you please stand and turn around? I'm gonna whisper 3 words and just repeat them back to me.
1, 2, 3. A, B, C.
Good. You can sit back down. Next, I'm gonna assess his nose. His nose is symmetrical. Can you please cover one nostril? Breathe in and out. Okay. Cover your left nostril or your other. So there were complications of his right nostril breathing. To tilt your head back for me, please. Patient may have a deviated septum, which is probably the cause as to why you're not getting good airflow through your right nostril. There are no sputum or turbinates. Next, I'm going to assess your mouth and throat. I would hand hygiene, then don gloves. So his lips are a little chapped. Nice pink color. No cyanosis around the lips or the mucosa. Gums are pink. No lesions or cuts in the gums. Open your mouth, teeth. Okay. Please open your tongue. Any lesions on the tongue? No. Lesions on the tongue. Can you please stick your tongue out and say ah? Again for me, please. Okay. In the back, the throat. Can you please move your tongue left, right, up, down? No problems. The hard and soft palate seem to be normal. Next, I'm going to check your neck. Your neck seems fine. There's no lesions or bruising on his neck. Next, I'm going to check your lymph nodes. 1, 2, 3, 4, 5, 6, 7, 8. And then, can you please shrug your shoulders to the front? 9. No inflammation of the lymph nodes. I'm gonna check your carotid pulse. Pulse is +2 on the left side, +2 on the right. I'm gonna listen for bruits. Please tilt your head back. No bruits. No bruits. Okay, I want you to move your head left, right, up, down. Any complications? Okay, I want you to resist. Resist. Palpate the trachea. trachea seems to be symmetrical. Is there any pressure, tenderness? No? Okay. Can you please stand up and turn around for me, please? Okay, check his thyroid. Any complications here? No? Okay. Can you please take off your shirt? Okay. Thoracic cage seems to be symmetrical. Any tenderness? Skin seems to be smooth. Everything seems to be normal. Can you take a deep breath in for me, please? Okay, I know. Nice. So I'm gonna need you to say 99. I'm checking your tactile firmness.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, no lumps or tenderness. Can you please bend over for me, please? Check your spinous process. It seems to be straight, and then no scoliosis. You can stand up. Gonna percuss. Your lungs. Okay. Next, I'm gonna have my hand over your kidney. Is there any pain, tenderness there? No? Okay. I'm gonna listen to your breathing. I just need you to take a deep breath for me. Seems to be clear. No adventitious sounds. Okay, you can sit down. Okay. Chest seems to be rising equally. Skin characteristics. No lesions. So I need you to say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. I'm gonna percuss your lung fields. So. Okay. Now I'm gonna listen to your breathing again. In and out, deep breaths. Next, I'm gonna check your range of motion for your arms. So can you please stick your arm out, across, up, down, around. Same thing with the other arm, cross, out, up, down. Any problems, any clicking, buckling? No? Okay, now I'm gonna test your strength. Please squeeze as hard as you can. Nice, elbows in. Okay, resist, resist. Okay. Next I'm gonna check your jugular vessels. Okay, +2, +2. This, you can lay down for me. No visible apical pulsations, no heaves from look, and no thrills.